If you are skipping over this video, you could be missing the one thing standing between you and the ability to live independently well into your golden years. Every day, millions of people over age 50 make a single communication mistake. One, they may not even realize that slowly chips away at their health and freedom. It is not just about getting older. It is about missing the crucial warning signs your body is desperately trying to send, just because of the way you talk in the doctor's office. And if you do not catch it now, by the time you notice, it might already be too late to fix. Imagine this. You are sitting in that cold doctor's office under bright lights, waiting for answers. The clock is ticking. There might be a line of patients behind you, and you know you only have a handful of minutes to explain why you are there. It is natural to be polite. Maybe you do not want to complain. Maybe you feel awkward talking about pain or embarrassing problems. Maybe you hope the little issues will go away on their own. But research shows this is more than just being humble. It is a hidden crisis that affects your health in ways very few people talk about. How many times have you found yourself leaving the doctor's office with your questions unanswered, or your symptoms ignored? Do you ever wonder if your words are really being heard, or if they are just being brushed aside as normal aging? If any of this feels familiar, you are not alone. A growing body of research points to a shocking truth. How you communicate with your doctor could be the single biggest factor in whether your symptoms are taken seriously, diagnosed properly, and treated on time. In this video, I am pulling back the curtain on the 8 most common, but overlooked, ways people over 50, especially women, can sabotage themselves at the doctor's office, and what you can do to turn things around. When you hear number 4, you will understand why it is often the silent trap that lets major health problems slip through the cracks for months or even years. This video is for educational purposes only and should not be considered medical advice. Let's dive straight in. The first habit we have to talk about is something so common that you might not even notice when you do it. It is all about how polite language, so gentle or indirect words, can actually work against you when you need help the most. We are taught from a young age to be respectful, not raise our voices, and not make a fuss, especially for people who grew up in an era that valued quiet strength and modesty. Being polite feels natural. But in the exam room, those soft words can mean urgent health issues get ignored. Research in patient education and counseling in 2019 observed that patients using softer, more deferential language were 22% less likely to receive proper follow-up than those who spoke firmly and directly. Let me give you a real example. Elaine, a retired librarian I knew, was feeling tired for weeks. Instead of saying, "Doctor, I have been unusually exhausted, and it's getting worse," she said, "It's probably nothing, but I just feel a bit tired lately." The doctor smiled, nodded, and sent her home with a reassurance. Months later, Elaine discovered she had serious anemia, something that could have been treated months earlier if her words had carried more urgency. That is what happens when politeness makes your body's warning signs sound optional. In everyday life, politeness keeps the peace. But in medicine, soft language can strip your concern of the urgency it deserves. If you find yourself saying things like, "It's probably nothing," "I don't want to be dramatic," or "I can live with it," stop. Instead, focus on being clear and direct. For example, say, "I have new fatigue that is stopping me from doing daily tasks." That way, the doctor understands it is more than just a background annoyance. It is impacting your quality of life. Closely tied to this is the next habit, speaking indirectly. This shows up as giving hints, skipping details, or framing serious issues as just minor annoyances. Sometimes it feels less intimidating to say, "I get tired walking upstairs, maybe it's just my age," rather than, "I can barely make it upstairs without stopping to catch my breath." But indirect talk can cost you critical time. In a 2018 study, also in patient education and counseling, they found that patients using indirect or vague descriptions were 40% more likely to leave without a diagnosis compared to those who were specific and clear. Take Gloria, a widow in her early 70s. For weeks, she told her doctor she just had little flutters in her chest. Nothing alarming. The doctor noted it as mild anxiety and moved on. 2 weeks after that appointment, Gloria was rushed to the ER with a mild heart attack. Looking back, she realized if she had simply said, "Doctor, I get chest pain every morning," there might have been a different outcome. Indirectness is a trap because time is short, and doctors are trained to prioritize what sounds urgent and specific. Instead of saying, "I've noticed a bit of a change," anchor your words to real experiences. "I have daily chest pain that wasn't there before." For many people, changing this one habit can sharpen a doctor's attention and shift a conversation from casual to critical. Downplaying pain is another major obstacle. Too many older adults minimize their symptoms, thinking they're being strong or positive. You might hear yourself say, "It's just a little ache," even if that ache is keeping you awake or limiting movement. But there is evidence that people who understate their pain are far less likely to get tests, scans, or referrals that could catch serious problems early. In fact, a 2017 study in the Journal of Pain suggests women who minimize their pain were twice as likely to leave the appointment with just reassurance, while men with the same symptoms got further investigation. Take Evelyn, who lived with a growing pain in her hip for months. She described it to her doctor as just a dull ache, maybe old age. No tests were ordered. By the time Evelyn returned with worsening pain, an MRI showed advanced arthritis that needed surgery. "If I'd spoken up properly in the beginning, I might still be walking the way I used to," she said. The lesson here is simple but powerful. If pain is changing your routine, keeping you from sleep, or getting worse, say so in clear terms. For example, say, "My hip pain is so bad I cannot sleep, and it's getting worse each week." Vague complaints are easy for rushed doctors to gloss over, but clear descriptions demand attention. Now, let's talk about apologizing. Over-apologizing may sound harmless, but it can actually convince providers your problem is not urgent. I have noticed that especially among older women, it is common to open a conversation with, "Sorry to bother you with this," or "I know you are busy." But according to a 2019 review in Social Science and Medicine, women were significantly more likely than men to use apologetic or deferential language, leading their complaints to be labeled as non-serious far more often. Ruth, a retired school teacher, is a perfect example. She came in with chest tightness but immediately said, "Sorry for taking your time. It's probably nothing." The doctor agreed, skipped over further tests, and rushed her out. Days later, Ruth was hospitalized for a heart attack that might have been prevented. When you frame your own health as unimportant, healthcare providers may make the same mistake. Instead, start with, "I need help with a serious problem." It is not about being rude. It is about being truthful and standing up for your health. Your health is never a waste of time. Another sneaky trap is talking too long without getting to the point. The urge to explain everything, give lots of background, or warm up to the real issue is understandable. Maybe nerves get the best of you. Maybe you are trying to be thorough. But research shows that most doctors in the US, UK, and elsewhere now spend less than 12 minutes with each patient. Every minute you spend giving extra context takes away from diagnosing your main concern. In practice, this means important symptoms are sometimes mentioned late, when the doctor's focus has drifted. A woman named Helen once shared that during her appointment, she spoke at length about difficulty sleeping, a poor appetite, and her frustration with daily routines, but only mentioned her frequent dizzy spells near the end, almost as an afterthought. By then, the main opportunity for diagnosis had slipped away, and she left with little more than generic advice about lifestyle. It was only weeks later, after a fall, that she was diagnosed with a heart rhythm problem, a warning sign she had been working up to share all along. If you do one thing differently next time, put your main symptom first, right up front. "I am here because I have had dizzy spells almost every day." That way, even if time runs short, your most pressing concern will not get lost in the shuffle. Sometimes people bring a family member along for support, which can be helpful, but when family or caregivers do all the talking, it can make a doctor overlook you, the actual patient. Studies show that when family members speak on your behalf, doctors are around 25% less likely to ask you for follow-up information. Lorraine went to her appointment with her daughter, who quickly described her mother as just tired, blaming age and not much else. Lorraine nodded and said nothing about the chest pain she'd had. Not being able to speak for herself meant that her main symptoms were never discussed. A month later, Lorraine was admitted for severe heart problems that could have been found sooner. If you do bring family, ask them to speak after you have shared your own experience. Doctors are trained to listen for clues in the patient's own words. Your own voice matters more than you think. Another hidden problem is forgetting your medications and supplements. Nearly 40% of adults over 65 in North America take 5 or more prescription medicines. Many add extra vitamins, herbal products, or over-the-counter pills to the mix, but far too often, people forget to tell their doctor about all of them. You might think it's just a vitamin, or that's not important, but these details are critical for your care. In fact, some studies suggest that a third of seniors forget to mention at least one supplement or medication. Maria felt unusually tired for weeks. She remembered to mention her blood pressure medications, but never told her doctor about the ginseng and fish oil pills she took daily. Several weeks later, she landed in the hospital with a bleeding ulcer, made worse by a combination of supplements and her prescribed treatments. Writing down every medication and supplement, no matter how small, can literally be life-saving. Put the list in your purse or wallet and bring it every time you see a doctor. That brings us to one of the most difficult but dangerous habits of all: hiding embarrassing symptoms. Nearly every provider has heard patients hide or forget to mention things they think are shameful: urinary leaks, bowel problems, vaginal or rectal bleeding, even small memory lapses. But these are often the red flags that signal serious, but treatable, disease. Jean was a 74-year-old who, for months, endured unexplained bleeding, thinking there's no way I'll bring that up. By the time she did, she was diagnosed with advanced cancer, and she told me, "I thought if I ignored it, it would go away." Ignoring never helps. Even small or embarrassing symptoms may reveal infections, early cancers, or heart disease. Always mention these issues, even if you feel awkward. Doctors have heard it all, and mentioning one embarrassing symptom could make all the difference, sometimes saving your life. Now, you may be wondering if this is mostly about communication, or if it is also about how society views aging, especially women's health. The truth is, it is both. Some studies have shown that older women, in particular, are less likely to have their complaints taken seriously than men of the same age. But whether you are a man or woman, these communication traps can affect anyone over 50. The goal is not to make you anxious or overwhelmed, but to put the power back into your hands, so you are not just another person whose body gives out before the doctor finally hears the real story. Let's take a moment now to tie all these insights together. Every time you walk into a doctor's office, remember that clear, honest, and direct communication is one of your best tools for staying healthy and independent. No one else knows your body the way you do. Do not let politeness, indirect talk, apologizing, forgetting medications, or embarrassment rob you of the care you need. Speak up, lead with your strongest symptom, and never assume something is too small to matter. Bring your medication and supplement list. If you need a family member there, let them support you, but always share your symptoms in your own words first. You do not need to be rude or demanding, just clear. If something is new, getting worse, or affecting your daily living, say so. If it hurts, do not sugarcoat it. And the single most important thing, do not keep secrets from your doctor, even if the problem feels embarrassing or personal. I would love to know, how old are you? And have you ever noticed yourself doing any of these things at the doctor's office? Maybe you downplayed a symptom, waited too long to mention it, or forgot to bring your medication list. If you have a story, no matter how small, please share it in the comments. Your experience might help someone else feel less alone and more prepared at their next checkup. If this video gave you even one new idea to protect your health, please hit the like button and consider subscribing for more real talk on aging, wellness, and living your best life. Over 50. There's always more to learn, and together we can keep each other stronger and more independent for years to come.